Welcome to another episode here at RewardLion. Today I have two special guests. We have Amanda and Dr. Nanda, the owners and founders of Jiva. Go ahead, Dr. Nanda. Can you tell us a little bit about you and your business and introduce yourself?
Yes, I'm Dr. Rakesh Nanda, founder of Jiva Med Spas. And we have different locations throughout the country and affiliations. One goal in mind is to help that patient from the inside out internally in a holistic fashion, help create longevity and promote positivity, lower anxiety, depression, lower the need for prescription-based medications, but help you live healthier, longer, be more functional, be able to jump with your grandkids on that trampoline, be able to get up out of that chair and not worry about, hey, I don't want my grandchildren one day to have to take care of me, because you have enough energy that even at the age of 80, 85, you're fully functional. That's the goal here in a natural fashion.
And you Amanda, you are in Boca Raton, right?
Yes, I manage the Boca Raton location.
And then you guys have another one in Tampa.
We have a location in Tampa and then Ohio offices and throughout the country.
So let's talk a little bit about Boca Raton, because this is home.
Boca. Yeah.
So what is it that you treat people, like what's the treatments, what's the services that you guys offer in Boca Raton?
So we have hormone therapy for men and women. We treat, we have medical weight loss. We have laser hair reduction. We have all kinds of aesthetics, Botox, filler, Sculptra. We have skin tightening with our Morpheus device. What else?
Men's health, tattoo removal. We are doing stem cells. We do hair transplantation. We do PRP for the scalp and the face. We do cellulite treatments, skin tightening, medical weight loss. You name it.
So it's really endless. So what is it that you actually really doing for your patients? Like, are you giving them a treatment, or are you actually trying to, or solving their, or helping them prolong a good life, a better life, look good, feel good life?
All of the above.
Yeah.
All of the above.
So wherever they're, whatever's causing them to, maybe feel less confident, or whatever their struggle is, we are helping them really on their confidence journey.
So it's everyone is base to base. Like they come to you, you see what they need, and then you advise them, and you have endless of equipment and technologies and resources.
Yes.
Okay, so that's good. So let's talk a little bit about, let's say, sexual health.
Sure.
It's been trending a lot, sexual health, testosterone. If someone comes to you, what is it that what's the first step?
A conversation, right? So talking to them, we can also start with labs. It's a great starting point. We draw their labs, look at those, find out where they're not optimal and how we can get them, their levels optimal and feeling their best. Talk about supplements.
And is it like something like I take one time and I leave, or is it consistent? Is something that has to be consistent?
So it depends on what you're trying to treat. It depends on what the ailment is. It depends on, your approach. If you're local, if you're from far away, some things require you to come in. Other things we can do through supplements and vitamins, for example. We can ship, depending on state regulations and rules. So we kind of have a different approach for everything, but that's the neat thing about this, is that it's an a la carte and everybody's treated differently.
So first step is really just the conversation and finding out like what your
needs
problem
are.
I think so, yeah.
Yeah, I mean, if you come to us and you say, look, I want to lose a little bit of weight, in this world of medical weight loss stuff, we have options beyond just a traditional GLP or GIP drug. We have other options as well. If you say, hey, I've already lost weight, but now I have all this muscle loss from losing all that weight and having incontinence, we have options for gaining muscle. We have options for incontinence. If you say that, I have ALS or I have MS or I have Parkinson's, help me function better, help me live a healthier life without all these pharmaceutical drugs that bog me down. We have approaches for that. If you've just had surgery, hip surgery, ACL surgery, you're an athlete and you're like, look, you know what, I want to get back into my game, or I want to get back to my life routine faster, better, without having to take all these pain medications. We got options for that. They're not pain medications. They're going to help you get back into it. So every single thing we kind of have an approach for. And because we are medical providers, because we are doctors, we actually do a full physical exam, we do blood workup, we take it from a medical approach, but without having to always use pharmaceutical drugs.
It feels more like concierge. Like
it is.
It's a really detailed and specific to the person versus just like, hey, I want Botox. And you guys would like if someone wants Botox and you look at them and they're, no, you shouldn't,
Yeah.
Don't mess with your face. And that's something I don't see often, because most small boutique clinics, they just order takers. People go in and want this, I want that.
Right.
There's no advice, there's no education. Even me personally, when I had sciatica, I called Amanda and she went ahead and gave me advice. I was back in like 1 week, 1 week, 2 weeks, I was good. If I would have went to a doctor, he would have probably put me on some narcotics and all kind of stuff. So the advice is very important.
Yes.
And for you to customize a solution for a person, it's more important than just giving them a quick fix here and a quick fix there. And in Boca, it's a prime location when it comes to people. They all want to look good. They all want to feel good. And Boca has a lot of treatments, a lot of clinics, but not a lot of clinics or medical clinics that will go in and pinpoint the issue that the core issue, and then they go ahead and take them step by step. Like you have a machine for what was it? Is like fungus?
Yeah.
What is it called, that machine?
So if you have toe fungus or finger fungus, onychomycosis, what you're talking about, our device will treat it, and we have more than one. You may have been on medications that cause liver problems and caused the need for blood tests. You don't need that with lasers that can treat this. And again, treated by a nurse practitioner or a physician. That is, again, the difference with us is that, you mentioned Botox, for example. You may say that you need Botox, and I've been getting Botox, and you can just go to a traditional med spa and go get Botox and fillers, because that's all they do.
That's it.
Or you can come to us. We have Botox and fillers too, but we're injecting you as medical providers.
Yes.
Number one. Number two, we're going to give you 4 other options that can get you almost the same results without Botox or fillers that will last longer, more natural, if that's what you want.
Education. You're
That's
giving
right.
them education,
That's
giving
right.
them advice, and then they decide what they want to do.
Right.
And if I go back to the subject, so I'm an athlete. I used to play soccer when I was young. We used to play in rain and stuff like this. So I did accumulate in one toenail fungus.
Yeah.
So I spent thousands of dollars on that, and it didn't get treated because they never gave me the advice that you told me. You told me, okay, you need to do 1, 2, 3, 4, 5 in consistency.
Yep.
When I went to these clinics, they're like, oh, it's $300, $500 a session. Oh, how many sessions? Maybe one. And then you do it, and then you tell them, hey, oh, you need another one. And then another one. Nobody was transparent that they like, oh, this is a 12-month program. You need to do this and this and this and this. And that happens in a lot of treatments, not just that one.
Yeah.
This one just because I relate to. And another treatment is like laser hair removal. I remember like my wife did laser hair removal. They're like, oh, just one session, thousands of dollars,
Yeah.
They're like, sure, yeah, one session, you're good. Lasts years. It's not true. You do that one session, and no, you need multiple sessions because the areas. So what you guys really offer is more of a transparency and education, and you have all the equipment, the know-how, the knowledge, and it's actual doctors. It's not like I have clients, they're not nurse practitioners, they're not doctors, they're injecting Botox. I wouldn't trust that.
Yeah.
Like this is,
Yeah.
It's a little bit tough. So what you guys are providing is really you guys have a really strong reputation. You know what you're doing. You've been in the medical field for a long time. You almost have endless amount of treatments.
Yeah.
And your goal is not to give them a specific treatment. Your goal is to make them feel good, look good,
Different
live
approach.
longer if possible. And not just live longer, having a better, what's it called? A better quality of life. And so let's talk a little bit about that. So we're talking about a better quality of life. There is longevity.
Yep.
So there is, DNA. There's a lot of things that's happening. What do you think is the direction that this industry is going to when it comes to prolonging and having a better life, feel, what is the steps that people should do? If I come to Boca into the clinic, what should be the first step if I want to live better, feel better? And what would be one of the programs that you can offer that helps with that?
Yeah, it's a great question. So usually we would start with the blood test, and we go way beyond what a traditional, primary care physician may order. But we order that as doctors, right? So we would get your labs, and we'd go really deep. And we'd also check your testosterone. We'd look at women's estrogen, progesterone, look at your calcium, your vitamin D, really deep down things. Look at that. Oftentimes it could be like a hormonal deficiency, in which case then we can prescribe hormones in the form of a pellet or injectables. We do all of that. If that's not the case, we can kind of look a little bit deeper. We can order actual functional medicine tests because we do a lot of functional medicine as well now. And so we can actually send out saliva, stool, urine, blood to a specialty lab that will then look at it, and we can actually analyze down to the chromosomal level and figure out what's going on. Where's the inflammation? And then we can prescribe supplements and vitamins or different types of complementary therapies to fix that naturally. Even with long COVID, extremely successful. People that have had cancer or end-stage kidney disease, solved it. No medications. Stage 3, 4 cancer, solved it. No medications. Wow. So you have to get down to the root cause, if that makes sense. It's a long-winded explanation, but I wanted you to understand that we have that option for all of it.
And in order for me to get that kind of level, that's not something I can just come in and have a visit and then this is a commitment. This is something where I have to commit.
It's not as hard as you'd think. The studies I spoke of, like let's say you're in a different part of Florida and you're 200-300 miles away. We could do a telemedicine visit with one of our functional medicine doctors, and they could speak to you 1 hour, get the whole study, like figure out what we need, order the studies that are needed. They ship it to your home. You then do all of this stuff. The kits are self-explanatory. You could do it in the comfort of your own home. And then it's a prepaid label and you ship it off to the lab. Within about 2 weeks, we'll have the answers. Then that doctor and you get back on the phone through a telemedicine visit, go through all the results and say, this is option A, B, C, D. This is what the problem is. And we could do it all that way. So comfortably, right? So you don't even have to travel far away. This is how we're now able to treat people from all parts of the country, focus on Florida right now, but we could do that very easily. And it may not require anywhere near as what you were doing with a traditional doctor, but be 10 to 15 times more, successful at treating that.
Because you pinpointing and analyzing and trying to treat the core issue, not just the symptoms.
That's called real functional medicine.
Yes.
And we have a functional medicine physician on staff that could do that.
Yes. And Amanda, you worked a lot with sexual health and helped a lot of men, with the what kind of treatments do you usually
for men's sexual health, testosterone's a big one, hormone replacement, again, starting with the labs. But we have Dr. Sam on staff, local here, and he does he has a lot of options for P shots, which is PRP. That's popular. We do shockwave therapy, really restoring the blood flow. This is for like erectile dysfunction. We have Botox, which is kind of a fun new treatment that's getting a lot of success and good feedback on. What else do we have?
But let's talk about sexual health, like sexual health itself. That's a big subject. Like it's not just an injection. People they just really need to see what's the underlying issue, right?
Absolutely, yeah. They come in and we try and figure out what's going on. A lot of it's just anxiety sometimes, but using some of the treatments can help them get over that hump and get some confidence back.
Yes. And the testosterone level, that's really common, like for men, like after 40, it starts slowing down. But I've seen a lot of guys that are in testosterone, but they're just going nuts.
Mm-hmm.
Too high.
Yeah. So is it because they're going to the wrong clinic? Is it
they probably are. They probably didn't get the right dose, perhaps. They probably didn't have the right labs, and that's where it came in. Or they may have had perhaps the wrong provider that wasn't as educated about what to do, because it's not just a testosterone number. There's also calcium. There's also other things you have to look at. And women you have to look at the estrogen, the vitamin D, the progesterone, and the testosterone. Also, your weight, your height, your lifestyle, all of that leads to what we call an optimal number. Optimal number is the right number to function, not just get by, but functioning optimally. So you don't know that number unless you have a tremendous amount of education on this.
Yes.
And I know a lot of people try to get in and do it, but that's where it gets dangerous. So, we believe that a pellet is much more efficacious than the other forms. But we'll go through all the different options. Yeah. Shots, pellets, creams, patches. We'll do what's right for you. But we have knowledge on all.
I've seen a lot of people, they just even order online, self-inject.
That's dangerous because that's dangerous because you don't have an actual physician dedicated to you watching over that.
Yes.
Right? We will assign you to a doctor or a nurse practitioner, someone, a medical provider that's your provider, and that's it. And they know your history. Just like you would go to your regular doctor for 10 years. Same thing.
And I think most clinics out there, because I work with tons of them, they're not like you guys. You guys are a little bit more into the caring business. Like they will just okay, prescribe and then let it go.
Yeah.
And if there's a complaint or problem and they're aware, let's change the dose.
Yeah.
Instead, actually go ahead and analyzing, constantly making
what's going on.
Yes.
Right.
Same thing with weight loss. Everybody is going crazy on the weight loss, but they're all losing muscle.
Yeah.
And which is a big problem.
Exactly. So we have the InBody at our office, which can really track that weekly. I have patients that come in, they love to hop on that, and we can really make sure that the dose they're not losing too, rapidly, and that they can really maintain their muscle because it is a big issue.
Yes.
You lose the muscle quick, you're going to have loose skin and all other, sagging skin you don't want. So it's important to
it's that extra level of care that matters. Yeah. It's not just about one-time treatment and go, because a lot of clinics and a lot of people that are not clinics, I don't know how they do it, but they're selling these things online, and just people are just self-injecting. There's no knowledge. That's why people are dying.
It's all random.
That's why you hear all those stories with the diseases. People are dying. People are going through this. And for me, I always believe the best is to have an actual local place or local clinic that I can trust, that I can go to, that can solve all my problems, not just one problem. So if I have problems with my skin, they have all kind of options. If I want to feel better, if I want to look better, if I want to go into preventative health care where I want to avoid what's gonna what triggers allergies or what triggers gluten, all that stuff, I would love to go to one place and get that done instead going to this doctor, and then this doctor sends you to this doctor, and then this doctor sends you to this doctor, and 3 months later, 4 months later, there's nothing happening. And what you guys are providing is a complete concierge service for your health, and right in the heart of Boca, and in the heart of Boca, by the way. So the surrounding areas, you don't have to do telehealth. You just come to Boca. It's a beautiful office. And you have all these beautiful people in there. And the knowledge that comes from behind Dr. Nanda or Amanda or Sam, Dr. Sam, that's what really makes a difference. It's that you can come, get a treatment, but in the same time get educated on what works for you. And your service is really endless. If we name every single service that you guys offer, it won't stop. And probably in another month, something else, then you join it. Because I noticed you're an innovator. Every time there's something, you just join it. Yeah. It started with, let's talk about that story again. Let's talk about how you started.
Yeah. It started from scratch, started from small, right? Regular medicine, working through hospitals, just like other physicians, other primary care doctors. And always was interested in something more holistic, helping anxiety, depression, treating children and adults, and helping the whole family and make them smile. And so I said, well, I want to open up one of these centers. I'm going to start with just regular Botox. So I started calling nail spas and salons, saying, hey, I can come offer Botox on Saturdays with hummus and fruit and cheese plate, and get your people in there. And not only approach your current clients, but also bring people that have never been to your nail spa or your hair salon to come get that Botox, but now they're going to seem wow, this place is so awesome. I want to get some service for here. So it was a win-win. And that grew from just one day a month on a Saturday to every Saturday. And then it was Sundays. And then people wanted laser hair and they wanted so much more, I found. So I started renting a laser and got successful at that. And got it so big that it came time to open my own place. Found a spot, rented it, but couldn't afford furniture. So I had to go get a box from just a regular, storage place and cut a hole in it and went to Bed Bath & Beyond and got a black tablecloth. That was my front desk. And it was just a sturdy desk, though. It was a great desk. It worked. I almost wanted to keep it because I was like, I need to keep this. Otherwise, it's a cardboard box with a hole. Oh, yes, I do. Yes, I do. And some of my patients from those days are still my patients now. They still remind me of it. They still send me photos of that office and say, do you remember this place? And I was like, this is great. Those are lifelong friends, right? But it makes you humble. It teaches you that, hey, you know what? This is the American dream. This is the dream of what we all had, that you have a passion. You follow that passion. You don't give up, and you can end up in, the right spot.
Yeah. What matters is the long-term care. Like, there's two ways of doing things. It's like you do things for money, which is not sustainable. Mm-hmm. But when you do things for a good reason, there's a good vision behind it.
It'll work.
It'll work. Like you have like your patients that are still your patients from the beginning to the end. My customers, like I still have my first customer I ever had in this business. And that's because, when you go beyond and it's about the care, it's about the person, not the number, then it makes a big difference. And for Amanda, like, let's talk about the relationship we have together in the business. And we, like, before we met, I think we met through, you purchased one of my clients, right? Mm-hmm. And then that client, that business changed from that to Jiva. Yep. But before we met, how many companies over the past 15 years were doing things for you, like marketing or Google?
So many different ones, because I found out that it's hard sometimes to find a one company for everything. So I had to have different companies doing different things. Like, I couldn't find that one company that could almost do all of it.
But what's the problem when you have all these companies, everyone is doing something? What happens?
They clash. They all bring some flair. They all want certain levels of access, and then they just things don't work well. They're not cohesive the way you need it, or you're way overspending money for things that are not needed.
That's true. And the alternative that you have with us, it's what the goal for us is always to create your own team. It's like, I provide human resource, I provide some technology, and I'm like, okay, so this is your people, they know what they need to do. You need marketing on Google, they'll do it. They need marketing on Meta, they'll do it. SEO, they'll do it. Mm-hmm. So what happens is that the solution, because that's what big companies do. So my idea and my vision was to create enterprise level for small and medium-sized businesses. So McDonald's, they don't hire a third party. They have their own agency. Yeah. They have their own departments. Yeah. For a small and medium-sized business to do that, it'll cost you humongous amount of money. It's huge. So that's why I created the fractional team. So, for instance, what does a small and medium-sized business really need? Usually they need a developer to do landing pages, set up some websites, so you always need a developer. Then you need a marketer, someone to run the ads on these platforms and understand how to target. You need a supervisor, like a manager, to kind of like make sure everybody is doing his job. And then you need designers and video editors for the content. So that's what I really provided. And then the system, which I know sometimes it's difficult, but the system helps track the performance. And by you having that, it doesn't feel like you're working with a company anymore, because now this is really becoming part of your, the more you ask, the more you want them to do things, they end up doing it. And it doesn't feel weird, because it's not with other companies like, oh, I need this. Oh, let me send you an invoice. I need that. Let me say, okay, we need to make changes. Oh, let me give you an invoice. This is a problem that gets solved now. Another thing is, there's almost nothing that the business needs when it comes to marketing and sales perspective that is not done there. Like, you just, it's available. Like, even us, I interviewed the company that was doing the SEO. You know, I have nothing to gain as a consultant, but in the same time, I'm like, there's a weak point in the business. I just want it solved. When we had the meeting, you know, I realized that this is the problem that a lot of business owners go through. They don't understand what's happening, okay? And because they don't understand, there's problems in the business that are not solved, and this ends up hurting the business. Like the SEO issue that you faced, you know, even though you guys are much, much broader when it comes to services, it's because the people that are in charge, they just can't make it for you. It doesn't work. You know, there is no straight answers. Like, they didn't come to you and like, okay, so our goal, like with me, I tell you always like, okay, the goal, we're measuring 5x, 6x, whatever. We try to like update the system. Let's see what's the problem. Oh, is the virtual assistant, how are the leads, or the quality, the difference between the campaigns that are bringing in cheap leads.
So you see, you're treating your customers the way we treat our patients.
Exactly.
You're really finding the root cause.
That's right.
And
You're like the similar, you're like analogous to what we're doing.
Because I really love seeing the independence that the companies have. Because the reason I opened this business in the first place was, I had franchises, and I did it for myself because I hired a couple of companies, got nothing, like just lost $5,000 a year, $10,000 a year. But I didn't learn anything, and I didn't understand anything.
Yep.
And every single time I talk to some company, it's a completely different conversation. It's like they sent you on a goose chase.
Goose chase.
It's insane. Mm-hmm. So I took a course, with I think it was some university. They charged me a lot of money. So I started understanding certain things. I implemented marketing strategies in my business that corporate Boost Mobile and corporate Metro, they took it and they ran it nationally. Like they literally, this is the rules now. Right. Exactly what this guy is doing. Of course, didn't even give me credit because franchises. But then I'm like, oh, I can do this for other customers. So while I had my business, I used to, I think we were driving in Boca, and I'm like, I used to leave the business, change my T-shirt, put my other T-shirt on, the RewardLion one, and then I walk and I go into the business. I'm like, hey, do you need help with marketing? Oh, what do I need? Like, we have SMS marketing, do you have a reward system? Because I used to do reward systems. So the goal is, it was built to help my business, and then I wanted to help other businesses. And that's what we're trying to do. We're trying to we don't want to give you a service.
Right.
We want to give you a team.
Right.
Because big dreams require big teams.
Yeah.
And for me, if I provide you a service, you're always going to be handicapped. You're always going to need me or need another company. But if I can provide you a team and technology that can help you see what's happening in your business, and the technology is really good. RewardLion OS, it's getting better and better. And when you start pinpointing, okay, you have a customer, and that customer is a paying customer, and then you start looking at the journey, oh my God, they saw me on this ad, they didn't purchase.
Thinking, yeah.
And then they went and researched the website, they still didn't purchase. And then they saw me here, and that's when they decided to purchase. So now you start seeing human behavior, and now you can improve your marketing. Because you guys are amazing at what you do, but your job is not really to chase people to come to you, the visibility.
Yeah.
And that's where your team comes in. That's what I try to do by providing you these fractional teams. Because the most successful CEOs I have are the ones that are super active with the team. Mm-hmm. I'm talking about, you know what? I want to do this campaign. I want a landing page. Here's references. Boom. I want to do SMS campaign on, preparing for Black Friday today, because I can coach so much. But in the end, if the owner is not independent, it's like, okay, let's always be proactive. Mm-hmm. Let's always use the team. Let's plan. What happens is the business only keeps getting better when I personally get involved. But I'm there just to teach and to train. Right. But once the owners, they're like, oh, okay, I understand their capability. I know a landing page will take 10 days to 2 weeks. Yeah. So now I prepare. I keep them busy because you want to keep them busy. In the end, they're only managing like 5 companies.
Right.
So they have full dedication. Imagine you have an agency that only manages 5 businesses.
Yeah.
How much attention can they give you?
Right.
So I don't want to prolong this because I know you guys are busy and I know you have a meeting to jump in. So thank you for coming again.
Thank you.
Thank you, Amanda. Thank you, Dr. Nanda.
Thank you.
Thank you for having us.
So we'll see you guys. This is Mike Ibrahim, and I'll see you on the next episode.